and thank you for being part of this COVID-19 vaccination webinar. My name is John Vasey, and I am a health and safety business partner at Auckland Airport, and I am facilitating this webinar today. Auckland Airport puts the safety and well-being of our people and the community first from the spread of COVID-19 by mitigating the risk of infection by ensuring our staff that work for us at the airport are vaccinated. We are proud to be part of and support the Park and Ride drive-through vaccination centre on Verissimo Drive, where staff, their families and members of the public can get vaccinated. With the Delta variant of COVID-19 in the community, it is more important than ever to get vaccinated and to protect yourself and your whānau from COVID-19. This webinar is to provide you with more information about the COVID-19 vaccination and to answer any questions you may have. I am joined by some great presenters who are very knowledgeable about the COVID-19 vaccine and vaccination. This includes Dr. Sarah Hartnall, an urgent care physician who is currently clinical operations lead at the Northern Region Health Coordination Centre. This is the organisation working on behalf of the 3 Auckland DHBs to manage the COVID-19 vaccination program across the Metro Auckland region. Aimee and Sally Schnauer, who are both COVID-19 immunisation education facilitators from the Immunisation Advisory Centre, IMAC. This organisation provides New Zealanders and health professionals with independent factual information about the vaccine, preventable diseases and the benefits and risks of immunisation. Sally is a registered pharmacist working for IMAC. Aimee is a New Zealand registered nurse. She works as an emergency nurse and is an authorised vaccinator. Sally is now going to present and show you a video, and there will be plenty of time for questions and answers session, so please use the Q&A function to send your questions. We'll try our best to answer as many of these as possible. We'll also collate the questions and provide written answers for you. We are recording the webinar so that you can share this afterwards with others that couldn't join us. We would really appreciate your feedback, so there will be a short poll at the end of the webinar. Now I'd like to hand you over to Sally Schnauer, who will explain about the COVID-19 vaccination.
Thank you. Let's just get organised here. Okay, thank you for that lovely welcome. Tēnā koutou, nā mai, haere mai. It's a pleasure to be here this afternoon to talk with you about COVID vaccination in New Zealand. And we're going to cover off the Pfizer vaccine, some efficacy information, safety, and some booster doses. So let's get started. So what is COVID-19? It really is a very serious and contagious respiratory illness. And it's much harder on our bodies and spreads much more easily than the flu. So it was really important for us to develop a vaccine to help stop the spread. It hasn't taken away, though, for the need for us to continue with measures such as hand hygiene and masks. COVID virus is spread by droplets. So when we sneeze and cough, they float around in the air, and masks help stop that transmission. And our good hygiene with hand washing and hand sanitizer helps to stop the spread from surfaces. So symptoms can look very much like the flu, so we test to find cases. It's really important to find those positive cases so we can look after those people and put some isolation measures in place to try and stop the transmission of the virus. You may have heard the term long COVID. It's a term used to describe the signs and symptoms that continue to develop after the original infection. And multiple body systems can be significantly affected, including our heart, lungs, and kidneys. And symptoms might be persistent or intermittent and relapsing. And they can persist for weeks, even months after the original infection. Fatigue is the most commonly reported symptom, but also shortness of breath and cough, headaches, something that we call brain fog, which is where we lose the ability to focus and concentrate well, joint, muscle, and aches and pains, and ongoing sort of effects of our taste and our smell, and sleep disturbances. So none of those things we would want for even a short time, let alone a long time. So what's in our COVID vaccine? Not actually too much. The most important ingredient is the active antigen, the mRNA, and that is something that instructs our bodies to make an immune response to the COVID virus. It also contains some lipids or fats, and they're in little bubbles that encase the mRNA so that it can easily slip into our cells. It also contains sugar, just like that you put in your tea or your coffee. And that helps stabilize the vaccine in that very cold environment, the -70 deep freezers. It stops the little lipid bubbles from sticking together and also sticking to the sides of the glass vial. And as well, we have salts. That helps the storage, and it makes sure that the kind of acidity of the vaccine matches and is in balance with our body when we administer it. So what's not in our Pfizer vaccine? It's really good to know that this is not a live virus, and there is no possibility that it can actually give you COVID-19 disease. It can't enter our cell nucleus, which is where our DNA sits. So therefore, it can't actually affect or alter or change any of our DNA. It contains no DNA itself, no microchips or human or animal cells, no blood products, no fetus material, no pork products. In fact, no gluten, soy, antibiotics, or even a preservative. So in some ways, it's quite a plain vaccine. We get asked a lot how it has been developed quickly. So it's amazing what the world can do when all countries collaborate and we're all on the same side. COVID-19 infection was a global problem, and many countries poured millions of dollars into funding a vaccine to prevent this terrible disease. So with that amount of money, companies were able to run steps in parallel. They started building manufacturing plants and ordering glass and syringes and needles for both the development and the manufacture of the vaccine, but also the administration. Normally, these things would all happen very slowly, but because there was plenty of dollars, they were able to work alongside one another. I think it's really important to note that no steps were missed. MedSafe, which is our New Zealand Medicines Safety Authority, completed their own process, not just relying on overseas information. And MedSafe continues to review data to validate the safety and efficacy of the vaccine. So how well does it work? And most especially, how well does it work against the Delta variant? So on this slide, we've got some information that has come to us from the UK, where there's millions and millions of people who have had COVID-19 and have also been vaccinated. We're most interested in our Pfizer information there in the first part of the table. So around 80% on average protection from infection. So 2 doses of the vaccine can protect us up to 80% from catching the virus, and even a little more from symptomatic disease. And that's really important, highlighted there in green, because if we're not symptomatic with COVID, it means we're not that unwell. It also means we're not coughing and sneezing and therefore passing on the virus to other people. And I think tremendously important is those last 2 rows there, showing the very high chance that you won't be hospitalized or die if you get infected with COVID. So, between 90 and 99% effectiveness against death. It matters a lot. However, let's look at New Zealand. That's where we live. That's what matters to us. That's where we are right now. And this is current data from November 2021 in New Zealand. The grey colour represents people who've had both doses of a Pfizer vaccine. The orange represents that they're partway through. They've had one dose and are due a second. And the blue colour shows our unvaccinated population. So you can see in the first bar there, we're doing a fabulous job getting through vaccinations with 80% of our population double vaccinated, with 10% more who've had one dose quickly to join those ones. The outbreak of cases in the middle bar there, most of our cases have come from our unvaccinated population, 67%, and the orange part there shows that around 20% of people who've had one dose have caught COVID-19 virus, and just 12% who are double vaccinated. But I think the most important slide, and it's what we're all worried about here in New Zealand, is the hospitalisation rate, those who are severely unwell. And you can see that 3/4 of the people in hospital are unvaccinated, with 20% with one dose, and just 5% of people unwell in hospital with COVID virus have had 2 doses. And that links back very well to the previous slide that said between 90 and 99% in the UK were protected from hospitalisation. And that matches exactly what we see here right now in New Zealand.